I'm very proud and very glad to be here today and to present this session dedicated on Sonovein, and I'm very glad we have such a high-quality panel to discuss what we can do with the Sonovein. So I'll try to be very brief to just show you a little bit of the device, and then I'll let the maximum time for our speakers to discuss more about their application. So just so you know, Thoracion, we're the company behind the Sonovein, so which is right now the only fully non-invasive device commercially available in the world. It's a radically simplified procedure for practitioner. It has robotic precision, live ultrasound imaging. We're very proud that it's developed and manufactured in France. And among the key advantages of Sonovein versus surgery, there is no incision, no tumescence, no sedation, no risk of infection, no recovery room. So the Sonovein, you can see one downstairs. We have one here. You will see everything is managed for a touchscreen. We have a robotized head, a consumable with a membrane filled with proprietary liquid, handle or internal cooling system, and very importantly, ultrasound system with a hand probe, so which enables real-time imaging and robotic precision. Obviously, this design is highly patented. So how does that work? HIFU, it's acoustic waves that are out of a transducer that is going through the skin and that are focused on a focal point. And at the focal point, we have a thermal deposition, which is controlled. And you can see here on the right how it looks on a real treatment head, where the HIFU transmission is here focalized here on this point. Treatment rate is roughly from 9 to 24 millimeter in depth compared to the skin. We treat different type of veins like truncal veins, perforators, GSV stumps, recurrences, and the treatment time typically takes 45 minutes to 1 hour. So how it works, typically it's a step-by-step procedure. We deposit heat one step at a time along the vein to treat. It's a very precise and targeted heating. As you can see here, the temperature profile that is at the focal point, which is very precise and targeted. Here is a little bit of what you can expect in terms of outcome, typically. So it creates thermal lesions, comparable to what you can see in traditional endovenous procedures that are also thermal. So typically, you would achieve fibrosis of the vein, and the vein would completely disappear after a few months. A few clinical results, but you're going to have more in the sessions to come. We've done a pivotal study between 23 and 25, approved by the FDA with occlusion rate of 96.8% after 12 months, 98.5% reflux abolition, no serious adverse events, 100% resolution of the pain. We have more and more peer-reviewed publications thanks to numerous speakers, more and more congress presentations. Now we have treated more than 4,000 veins, and we have, as I said, more and more publications in the pipe. So this is just an introduction of the current Sonovein, and we have new features coming up for the future generation of Sonovein. Just to give you a little bit of perspective, for the future, we're going to have, in the years to come, faster treatment down to 20, 30 minutes. We have demonstrated some of it in some clinical trials in Prague, where we treat with this prototype here under 30 minutes. We're going to have AI-guided features that we are implementing right now to have the device being easier to use and easier to adopt. And we will reach more and more patients with more vein types, larger veins, deeper, more superficial veins, and the like. And the key enablers for that technology roadmap are AI, acoustics, robotics, and clinical practice. So that will be able to scale globally. And we are now commercial in Europe, in the Middle East, and we will soon be in the US and in China. So thank you very much for your attention so far, and I'm very pleased to introduce the next speaker, Simon Jelinek. Thank you so much.